Dr. Mohamed Taha is an AGU graduate of 2018. He completed his internship in King Hamad University Hospital in 2019. He worked as a senior house officer in pediatric department in King Hamad University Hospital, and currently he is a first-year pediatric resident at University of Chicago in Chicago, Illinois. Dr. Mohamed Taha, it's our pleasure to conclude our talk with you, and you're most welcome to start your presentation now.
Thank you. Dr. Mona.
Great to see you, Mohammed.
Always great to hear from you, Dr. Mona. Thank you guys for inviting me. I don't think I need to talk about myself more, but because I'm the last person, I think today, I was just going to say, like, you guys should be very proud of yourselves. I feel like in medicine, we usually don't sit back and think about how much we accomplished so far, like no matter on what level of your career you're in. Like for you guys, like getting into AGU, studying, passing your exams, thinking about your future. In medicine, you're always expected to know the next step in everything, like even like the next best step in like picking a test to do for a patient, and like with your career and your personal life. So you never sit back and take a deep breath in and out, thinking like, you know what, you're good. Like everything you're doing absolutely fine. You know what I mean? It's important to remember that like being a doctor, it's an honor, it's a duty, but a duty you chose to do. So anything you do, um, like any effort you put into it, you're giving a lot back, not just to yourself but to the community as well. So I just want you to remember that, like, especially now, you guys are like studying in a time where textbooks for sure are going to change. Like, there's so many new things we're learning about COVID, and like the way we see medicine is very different now. Like, especially with telemedicine and all that stuff that we before. I have to be honest with you, like, because I was an intern before COVID, and I don't think we ever thought about telemedicine. Our hand hygiene was not the best, to be honest. Me personally speaking, I was very bad, especially in pediatrics. Um, and now all of that has changed. So another thing you have to keep in mind is that you are being in medicine is very difficult. Being in med school is very difficult, no matter which med school you go to. And there are always resources for you to get help. AGU has those resources. It's because in AGU we are such a close family. Sometimes you don't feel like you need it, but I just want you to know that the resources are all around you, and all the faculty members are there to hear you out. Trust me. Like if you just like even Dr. Mona Arakat, I don't know if you remember Dr. Mona when I came to your office and I started crying about the decision about
I
deciding.
do.
Exactly. Okay. So like, and she was always there. She would always take time. She's super busy, but she still took time to like lock the door and to sit down and talk to me. So people, there are people all around you who love you and want to take care of you and want to see you and go to good places because they do know that those people will come back. So again, AGU is amazing, and I'll talk about it in a minute. I think we already talked about this. So I did my internship in KHUH. I worked in KHUH as a pediatrics senior house officer for like 10 months. And then now I'm a resident in University of Chicago in pediatric neurology. The first 2 years is pediatrics, so now I'm in pediatrics. Um, it goes without saying, I love AGU. I'm sorry for everybody who's not from AGU. I love you guys too, but like family is family. Everybody from Bahrain is family to me, but still, um, it's very easy for you to feel like, oh, you don't feel special because you went to AGU, whatever. Let me be honest, completely honest with you. I am so lucky and happy that I went to AGU. 100%. I don't have any regrets or doubts or anything because I can't tell you how many times now when I'm answering questions and people are surprised that I know that information. And the first thing that comes to my mind is like, oh, I remember in unit 4, problem 3, we studied this about this. And like, I know, and even if I don't remember the information, I know where to find it very easily. That's because of AGU. And believe it or not, like our problem-based learning system is new here in our region, like in the Middle East. but it is not new here in the rest of the world. Like in the US, almost most universities follow a problem-based learning system. So and the people around you, just remember that all of your colleagues are going to, all of your friends, everybody that's with you in university, you're going to see them around as you guys like move on in your career. And I see it all the time with like for example, all of the consultants we see, they were colleagues together in university, and most of them they were colleagues together in our university. So like to put things in perspective, like you're not just making connections, you're making friends for life. And you'll see in the future, I'm waiting for that time when I go around, I'm like, oh yeah, I know this guy, I know this guy, I know this guy. um, so always put that in mind when you're talking to your friends and your colleagues. um, One thing before I again start talking too much, I'm sorry, is that things change things change a lot. Okay, this is your life, your career is your life, but you also have the rest of your life, like your health and everything is very important. And I would say this is me, this is Ahmed Bachiri, one of my, these are two of my close friends, Abdullah Faisal and Ahmed Bachiri. We all said together we're going to do the steps and go to the States and do residency together. Obviously that did not happen. Abdullah did, for example, all of the steps, but he wants to be a cardiologist and he went to BDF, and they give you a different route there. And so that he pursued that route. Ahmed, for example, wanted to do the exams, but he had situations where he couldn't do it. And then, for example, like last year, he got like leukemia, and he had to be treated, and it changed his life 360 degrees. And this is him after getting the first round of chemotherapy, and his life was on hold. And like really puts your life in perspective, thinking like anything can change any minute, like literally any minute. And this, the perfect example is the pandemic. So live every moment, be happy. um, Everybody is different, everybody's career choices are different, so that's something you have to really put in mind. This is just pictures of, like I went to the same places. I don't know if you guys can still do this or now because of COVID, but we used to go to coffee shops to study all the time, and I love doing that. You can't do that anywhere else except Bahrain, just so you know. And that's why I love Bahrain as well. Okay, let me skip. So why go to the USA? So it depends on what your goals are, and everybody's goals again are different. Um, some people want to move there. Some people want to like live their life, the rest of their life there. So if that's your goal, and you're going to be a physician, then that's a very feasible goal. If you just want to get good training, you can definitely get good training there. There's no doubt about that. But you can also get good training in Bahrain and Saudi Arabia. Okay, so if it's just for you to become a radiologist, the radiologist, for example, then I wouldn't put USA as the number one thing in your mind. You have to think about everything else in your life, your family, your friends, and all that stuff. So because you can get good training in Bahrain, so you don't need to travel halfway around the world. You're married and you have like 3 kids, you know what I mean? You have to think about everybody else in your family and what's good for you. Um, and then otherwise, if it's just because you want to become subspecialized in something, you can definitely go and do your fellowship there. You don't have to do your residency there. So what I mean to say is that you have to sit down and think about your goals, because it's a very big decision to make, and it really will change at least the next few years of your life, if not the rest of your life. So um, you have to sit down and make that decision on your own. Nobody will make that decision for you. Obviously, if you have a family, talk to your family. Um, the good thing about the USA is that you don't have to be sponsored. You're going solo. Everything you do is based on your hard work and what you did. Um, Other ways, like for example, if you want to go to Canada through BDF, you have to be sponsored. Um, these are it's less complicated, but like getting to the USA, sorry, is less complicated because you do everything on your own. However, you still can feel really bad if things don't go your way. You have to do a lot of things to make yourself stand out, because there's lots of people applying from all around the world, right? When in comparison to the UK, the UK is very complicated. I think like navigating their system and where you start off is very complicated. In the US, it's not the same. Everybody comes and starts from scratch. Like you do all of this hard work, you put this face, you do all of the things you need to apply. When you start residency, everybody's treated the same. So there's nobody starting ahead of you, before you. There's no such thing. So what do you need to do to work in Bahrain? I just mentioned this because it's important to know. you have to finish medical school. Why am I saying this? Because I don't want you to invest. If you want to go to the US, I don't want you to invest your whole life studying for the steps and then not passing your AGU exams. No, that doesn't make sense. You can't go to the States unless you pass your exams. You have to be a doctor. So that means priority number one is to study for your AGU exams. Priority number two is to study for your, for example, USMLE. No matter how big of the priority it is to you to go to the US. Okay, and I always did this when I was in AGU. The first thing that came to my mind is I need to give each specialty the respect it deserves, each rotation the respect it deserves, because people worked very hard to make it happen, and it's not out of nowhere. Like it's very well defined for you to learn. So, and that's the way our university runs. Like I want to give you all of the key information. So if you don't pay attention, you'll miss out on some of the key information. Applying for internship, you need to finish 1 year of internship for you to get your Bahraini license and to basically join the Saudi or Arab board. So if that is one of your backups instead of going to the US, then definitely finish your internship. Plan to go to the US after. Again, it all depends on you. There are lots of people who apply right after finishing medical school, but then you don't finish your internship. So if for whatever reason a pandemic happens and you can't travel, then you're stuck. And some people are very nice and they'll let you come back to finish your internship, and some people are not. So um, there's too many things up in the air. So if you really think that you might want to stay in Bahrain, or you go to the Saudi board or Arab board, then definitely finish your internship. Um, in Bahrain, you have to work as service basically until you get into a board. And sometimes it's very hard, it's very competitive. There's not a lot of positions. Sometimes you have to be sponsored. It's like in the Saudi board. Um, but obviously, when you're in AGU, kind of like if like you know all the people there, and when you see them in the hospital, they kind of know you, and that's one of the pros of being in AGU. Um, if you're hardworking, you will stand out. People will know who you are. But then sometimes you have to accept the fact that sometimes in life, some people will get ahead of you because of the people they know, and that's absolutely fine. You find that everywhere. It's not just in Bahrain. Okay, it's not an excuse for you not to work hard. Um, what do you need to do to get there? You have to register in something called the ECFMG, which is the people that deal with foreign medical graduates. Um, that takes a very long time. It's a very long process. But our university really helps out with that, and they're very familiar with the process. You have to do your steps. You have step one, which is the most difficult exam. It's the one that we usually do during med school. It has lots of undergrad plus like basic sciences plus clinical year stuff. Um, the score you get in step one is a really important score. It really defines how well you do in the match and stuff. But then again, it's not the only thing that defines who you are. The other set of exams is called the Step 2 CK. And I believe now they stopped the Step 2 CS. There's like this whole thing in the news that I think they stopped doing the Step 2 CS. So Step 2 CK is a multiple choice question exam. It's mostly clinical knowledge. That's what the CK stands for. And then clinical skills was a oral exam, like, the kind of like our OSPE exams, or the clinical year exam, basically. Um, they think they stopped that, but when you're in AGU, I don't think that really makes you too scared because we do this all the time. People here, by the way, in the US don't do this a lot. Like they don't work under pressure as much as we do. And like in the OSPE, like you have to move every 2 minutes. If you think of the bell that keeps ringing and you keep moving, whenever I try to explain it to people here, they're very shocked. So um, and then you can apply for the US match with just having this. If you're registered, you have your Step 2 CK and CS, and Step 1, you can get ECFMG certified and you can apply for residency. However, to make your application strong and stand out, you have to have US clinical experience, and they usually say about 2 months. Now, getting US clinical experience, especially now, is very hard. You can pay to do some externships, which are not any, like, they don't feel good because you're paying money and like you're not really officially there in whichever clinic you're in. However, like you can email as many doctors as you want in the US, and somebody will answer and say that they can, like they'll let you come. Um, but generally speaking, you need to get US clinical experience so that they know you can get a letter of recommendation. The goal is to get a letter of recommendation. However, I have to be honest with you, I got letter of recommendations from people in Bahrain, and, like if you can't, I'm just saying it's not the end of the world if you can't. Okay, it's not the end of the world in any of this situation. If you don't do any of this, it's not the end of the world ever. Okay, just so you know. Um, the application season takes 1 year. almost 1 year for everything. Like when you're applying, so you apply, you start applying in June. The application closes in September. Your interview starts from November, like November, December, January. You find out if you get matched in March. You start in July next year. The question for you that you think you need to think about is, what are you going to do during this time? Are you going to sit at home? Are you going to do research? Are you going to work in the university? Like, there's so many things to think about during this time. It's 1 year of your life. You cannot waste. Because people will ask you what you did during this year. Important thing to know is that when you're applying, you're on a J. If you do step 3, you can get the H-1B visa, which means you can apply for the green card when you're in the US. If you don't, which is I have the J1 visa, it's called a cultural exchange visa. So that means you have to come back after 7 years to work in your home country for 2 years. It's kind of like a deal between USA and Bahrain, or the country you're from, so that you know that after you finish your residency and plus or minus fellowship, you have to come back to Bahrain. There are ways to waive this requirement, but that's generally the requirement. The other thing to keep in mind is that sometimes places don't want to accept applications from people who have been out of graduation for more than 5 years. However, that is not the rule. There are lots of people who got accepted much later. There are people who did all of their exams while they were in internship or after internship when they're doing their SHO position and still got matched. And a perfect example is like Hafsa Bouchiri, who is my friend Ahmed Bouchiri's sister, who is also very well known in AGU, who is doing her now doing her fellowship in pulmonary and critical care in Henry Ford, which is one of the best hospitals in the Midwest. Okay, so you got matched. This is me. I got matched. I was praying. I was waiting the whole day. And then I prayed al-Maghrib. Then obviously I got the email while I was praying. You know, that's God doing His magical thing. The question is, it was during the pandemic, and I was like thinking about all of the things that were going to happen. I didn't get to say bye to any of my friends. I didn't get to say bye to any of my family. I couldn't say bye to Ahmed because he was undergoing chemo and I was working in pediatrics. And I can't go meet people. I can't go to AGU because AGU was like basically closed. Um, like it was a very hard time, but like it was fine. Like I felt happy, obviously, but you still have to question the rest of your life because this is the thing that you've been waiting. We've been waiting. We talked about it all the time. Me, all the people with me, Mohamed, Dr. Mohamed Wa'el, all the people that you see here that I know. And then now I'm alone. You're you by yourself. Nobody else is there with you. You're moving on your own. This is me and my nephew. I love my nephew a lot, and like it's hard not to see him for a year now, and I can't go back. So it's a big thing. Um, However, again, I'm gonna say this, and I say this. It's very hard to say this, but you do you. So that means if you feel like you can't do it, there are people I know who got matched and decided not to go, because it's a big decision to make, and they felt like they wanted to do something else here in Bahrain. So it's never too late to change your mind, ever. As long as you make the deal with yourself, you tell yourself, this is what I want to do. For now, maybe in a year you change your mind. As long as you believe in yourself, because nobody can make decisions for you. USA, the residency programs last anywhere between 3 to 5 years. Pediatrics is 3 years. The board exam depends on what specialty you're doing, but most of the time it's now MCQ. Before there was like more oral exams, but now it's mostly MCQ. The residencies here are very fine-tuned. There are lots of requirements. Americans in their nature, they like fighting for their rights and stuff. So if there's something wrong with the residency program, it will be fixed because people will complain. So that's what's good. It's very standardized, more or less. So that's what's good. You get training that's standardized. So what did I do? So in year 4, I took step 1 in the summer. Between year 5 and year 6, I did an elective in Montreal, Canada. It kind of helps in the US, but not too much. Year 6, before doing internship, after graduation, literally the day after, I did step 2 CK. And then during internship in March, I did step 2 CS. I finished internship and I applied for SHO position in KHH, and they were very kind enough to accept me. And I was in SHO in pediatrics. But before then, I said, can I please go to the US and do some electives? And they said, okay, which is, again, very rare. So I was very lucky. And then my interview seasons ranged from October to December. And then I continued working in pediatrics until I got matched. Um, and then 1 month before I traveled, I stopped. And there's lots of logistic things that I can talk to you guys about if you guys ever have any questions. Any questions you have, just come and ask me. Because if you work in KHUH, you kind of get into the military, and like there's lots of things you have to deal with. And I've been through all of that by myself, and I know how to navigate through it. And I'm more than happy to help anybody who needs to navigate through it. Okay, do you need to do it this way? No. Do you need to do the exams? No. Do you need to do your residency in the States? No. Do you need to do your residency outside? No. Perfectly good residency. Saudi board is now becoming almost as good as the recognized board as a USA board. A lot of the physicians who run the Saudi board all trained outside, all trained in Canada, in the US. The reason why they went out is so they can make good boards in the Middle East, and that's what's happening. So maybe in the future, the Saudi board will be more recognized than the USA boards. I mean, healthcare in our part of the world is much better. It's free, like it's socialized healthcare. So maybe there's more benefits doing it here than there in the future. But I'm just saying that you don't need to do anything. If you want to, if you put everything together and you feel like you want to, then you should. Um, I'm very lucky to have met so many amazing people along the way. All of my friends support me. All of the people in university support me. Um, you need to be patient. I'm not patient. Is, my dad is very impatient. Okay, very impatient. Very impatient. Okay, but you still have to be patient. Medicine means you have to be patient. Um, I personally recommend you guys doing an internship in Bahrain because the way our system is structured is that you get all of the medical education during medical school. You get some clinical experience, very good clinical experience, but you're not you don't work in the hospital. Working in a hospital is very different from visiting a hospital. And in the US, even though they work in the hospital, it's still kind of the same thing. They don't really know how it is to be an employee in a hospital where you get paid and you have responsibilities. And in Bahrain, because we do most of it in internship, it's very important for you to get that experience. Plus, you'll get experience as working as a job in each specialty. People in the US don't get that chance. You guys do. We all do. And that's very important, very valuable, very valuable. And you make connections, and like for example, me, I worked in pediatrics. I really liked them. I found out I liked pediatrics. The people, like the head of department, liked me. I applied. They accepted me. They helped me through the whole process of me applying to the States. It's all about communication and um, like making connections, because again, these are people I will work. Even if I decide to move back in the future, I'm going to meet these people again, so I have to be good with them. I have to know them. I have to understand them. You have to understand Bahrain, what common conditions there are in Bahrain, how to talk to people. Even me, my Arabic is horrible, 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 but like I learned so much by just working and working like as in pediatrics and KHS, because you have to talk so much. um, and so that's, I think you should do it, and I think you should apply for a Bahraini license so that you can work in Bahrain, just in case. And last but not least, everybody calls me Wild Mary. Like, I'm like, oh, I don't speak a lot of Arabic, blah, blah, blah. So I always had the impression that if I come here, I'll fit in. I'll be honest with you, I don't fit in that much, actually. I'm actually very proud to be from Bahrain. And I make it very obvious I'm from AGU, I'm from Bahrain. Very obvious. Because you stand out, and it's always good to stand out, because people will hear you. People will notice that you know things, that you do things. Um, so even for those people in AGU who feel like they're very Americanized, just remember that you grew up in Bahrain. Bahrain is very different. We all feel the same. We're all like a big family here, and it's not always the same case. The last thing I wanted to talk about is pediatrics. I feel like it's my duty to talk to you guys about pediatrics because I love pediatrics. Um, Pediatrics takes a lot of patience. You have to be advocates for your patient. You have to fight, 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 even if it means you have to fight with your consultant about the decision. You worry a lot about your patients all the time, because you sit down, you're like, I hope I made the right decision for this kid. Like, you don't want to affect the whole family. You have to talk a lot to the family. You have to learn how to talk to families. You have to learn to like pay attention to what they're saying. And then sometimes you have to learn to not that you can't help people, but you still have to know how to make them feel better. um, Obviously, the pros of being in peds is that you see cute kids all the time. Kids do the funniest things in the hospital that make you laugh. that make up for all of the like the if you stay up all night, it just makes your day. You learn a lot. Like I can't tell you how many times like I talk to a family and they like their kid has like for example abdominal pain, and I think like for example it's H. pylori. I treat them and they come back and then they still have the pain. I feel like a horrible doctor. I'm like, I'm so bad. Like how can I not help this kid? He's in pain this for the past 3 months. And then the family says, you know what? I, I don't think I'm very happy that you're his doctor. This is what the father told me. He's like, at least you listened to me. Like he said, at least you sat down, you explained to me everything. You said your train of thought. You said what to do next. You told me when to come back. Honestly, we can work through the next steps. I'm very happy with you, you know? So it makes a very big difference. And pediatrics, where it's a teamwork and effort, no matter what you do, you will always need something to learn. Like there's always something to learn. And that's why I love pediatrics. Okay. So that's my story. If you have any questions for me, I mean, you can ask questions now, but you can always WhatsApp me 24/7. Don't think about my time because it doesn't matter. I will answer you as soon as I can. And please don't call me, hi, doctor, I'm sorry, blah, blah. No, I'm from AGU. You are my family. Please message me like I am your friend. That's it.
Thank you, doctor, for your presentation.
Thank you, doctor.
I have a question about the best resource to study pediatrics.
Ooh. For you mean for the rotations?
Yes.
Okay. I honestly learned a lot from going to the rotations. We used the BRS Pediatrics a lot. I used Up to Date a lot. There was this book, the Baby Nelson. I think it was like the Egyptian version of Nelson's Pediatrics. That was nice too. I'm trying to think if there's any specific. Like I didn't read the big Nelson's textbook because you don't have time to read it. Our rotation is very short. I think that's enough to get by. Yeah. Yeah.
So it's all about BRS.
Honestly, because like what you use BRS for is as a guide, as your guideline. What you do is you expand from it. Like you use it as your structure for which chapters to read. Like for example, you start with neonatology. You read about like for example in neonatal jaundice, and then you go on like Up to Date, or you Google like algorithm for neonatal jaundice, and then you keep adding to the resource. You know what I mean? Because it gives you a good foundation. But everything else you get from it is usually from your rotations and from the lectures that the consultants give. But I've not even until now found a specific resource that gives you all the information you need about each topic. But just to give you a heads up for neonatology, I think Baby Nelson was very good. So I would read BRS Pediatrics like as an outline for like for example neonatology, but then you open the Baby Nelson book for you to find out like all the stuff about jaundice. I remember it was very good for jaundice. Baby Nelson was very good for jaundice, very good for the rashes, the red rashes of childhood, and infectious disease. This is from the top of my head. Remember, I'm trying to go back 4 years. So
Okay, thank you.
Ooh, I'm looking at the chat.
مقصر.
I'm sorry, I know I talked too much and too fast. That is one of my biggest problems. I'm trying to learn to be better though.
It was very beneficial. Thank you, doctor. Thank you so
Oh,
much.
I have some questions in the chat. Maybe I can answer them real quick.
Sure, you can answer.
How many months do I need to prep for USMLE step 1? Oh, very good question. If you're gonna do it during AGU time, I would spread it out over the year. I would start studying from like if you're in year, whatever year you're at, like you give it sometimes. I wouldn't give it less than 2-3 months because there's so much to learn. But yeah, thank you, doctor, for your great talk. Thank you. Do you think there's still time to start now? Yes. If there's anything that I'm trying tell you guys is that it's never too late to make any decisions. You can do it anytime you want. Why Chicago? Somebody asked. So I did not explain this. It's a very fantastic question. The US system, the matching system here is an algorithm. You apply to places. Places invite you to interview. You rank them according to the ones you liked, and they rank you according to who they liked. And then there's a secret algorithm that nobody knows how it works that matches you to a program, and that's why it's called the match. You only find out in March where you match. So why Chicago? I mean, I like Chicago. I put it as my number one because the university is very nice, and I like the city. But I didn't get too much choice to decide exactly where I end up. Okay. Let me see if there's anything else. Does US clinical experience make break an application? Can we do it without it, especially now with COVID? I'm pretty sure now with COVID, people are gonna let it slide. It does make a difference with lots of places. However, it's not the end of the world. Hafsa Bachiri, for example, got into Henry Ford because they know our university and they've heard of it, and she didn't have any US clinical experience. So it's completely up to you. Can we get into US board without doing any electives there? Yes, that's right. Can we message you if we're not from AGU? Of course you can message me if you're not from AGU. Always message me. It doesn't matter where you're from. Even if you're from Venezuela, it's fine. Okay. I think that's... Why are you specific reason to go to the US? I feel like that other talks, people who spoke mentioned this. You learn a lot by changing getting out of your comfort zone. Me specifically, I wanted to do pediatric neurology, and we don't have a residency program for pediatric neurology in Bahrain. And so that's one of the major reasons. And you don't need to be sponsored in the US, right? And that's one of the... For all of the people that don't have connections, who need to, stand out like by yourself, then US is a good place to go.
Thank you, Doctor.
Sorry, I know. I'm sorry, Hassan.
لا totally fine. It was very beneficial الصراحة يعني you made it so easy for us and hard in the same time to apply. Inshallah. And you kept your WhatsApp, and I know you're always welcomed for any questions.
Yeah.
Inshallah عليك, very patient.
There are lots of people that asked questions that I didn't answer, so please feel free to message me on WhatsApp, okay? And I'll answer your questions, okay?
Because, yeah, thank you so much.
Thank you.
And have a nice day, dear.
Thank you.